Hello, everyone. My name is Andrew Esch. I'm a physician and a consultant to the Center to Advance Palliative Care. And today I've been asked to talk to you about managing lung cancer symptoms and improving quality of life. So with cancers like lung cancer, quality of life can be severely impacted. There is, things that happen from the illness itself, shortness of breath, cough, some people have pain. Those symptoms can be pretty distressing. There can be also symptoms and distresses from the treatment itself. So quality of life can be severely impacted by all cancers, lung cancer being one of them. And so today we just want to talk about what we can do about it, how we can help, and how people with lung cancer can live the best possible quality of life while going through their treatment for the illness. So what we hope to accomplish today is to talk about the symptoms and side effects of lung cancer, talk a little bit about palliative care, what it is and how it can help. We'll go through some frequently asked questions that patients and families often have, and we'll talk probably quite a bit about the website getpalliativecare.org, as it's almost irreplaceable resource for anyone living with a serious illness like lung cancer. So we're really good, physicians like myself, we get a lot of training on how to treat illness. But what we've discovered, at least in palliative care, and at least I have in my years of being a physician, is that treating the pain, the symptoms, the stresses of any cancer or serious illness, and the aftermath of that is as important as treating the illness or the cancer itself. So, we want our oncologists to focus on curing a cancer, like we do. We want them to fire every gun on deck as they have to help us to live for as long as possible and hopefully get cure. But while we're going through that treatment, we often struggle with anxiety, stress, worry, difficulty breathing, shortness of breath, constipation, fatigue is really common, stress, neuropathy. A lot of people have pain. A lot of people struggle with weight, both gaining it from some of the treatments some of the treatment side effects or losing it. Nausea is a pretty common problem, some memory issues, depression also common, cough, and there's even more that people suffer with. But we don't go through this in a vacuum. It's not just like, okay, I have this problem, the oncologist is going to treat it and nothing else is going on around me. There's all this stuff happening at once, which can make it a little bit impactful on patients living with it in terms of decreasing their quality of life. So, what do patients want? Well, what they want's not complicated. Getting there can be challenging, but when serious illness like lung cancer strikes, people want to be cured. They want to keep the disease in check, and that's the number one goal. But they also want to maintain good function and quality of life, also a number one goal. So, let's cure or keep the disease in check, but maintain as the best possible quality of life we can. They also want to have coordination and connection of care. They want to know that the people taking care of them are a team and are talking to each other. And they want support to help make informed decisions, because any one of us that has lived through a serious illness knows that it comes with a lot of decision making, and we want someone that will sit down and talk to us, tell us what the pros and cons are, and let us make an informed decision. So how well do we do that as a health system? And the answer is not very good. We are very much driven by technology and disease. We do disease targeted treatments because we're basically focused on sick care. And that focus in our health system shortchanges quality of life. So one of the challenges is that most physicians like me didn't get formal training in school or even in our residencies to assess or adequately treat pain, symptoms, and other distresses when it comes to serious illness. So it's a challenge for clinicians like myself to do better about the issues faced by patients and survivors. Because they want the best of quality of life in addition to the best of what they can get in terms of treatment. So we need to put the patient and the caregivers, the families at the center of healthcare. We move to a patient-centered approach, which recognizes patients' health problems as the patient sees them, not as we see them. It focuses on the whole person and includes the caregivers in the unit of care. And it provides a foundation for better recognition of health problems and needs over time, and helps us to get you the appropriate care for these needs in the context of your other needs. So that's a mouthful, but what are we basically saying here? We want to know what it's like being you living with lung cancer or whatever other health problem you may have. And we want to provide you a place where you know that what you're feeling and what you're living through is going to be recognized, and that we can come up with a plan to address your experience and make it as good as possible without just focusing on the disease itself, looking at things from a 360 and taking care of you as a whole person. So how can palliative care help to this approach? Well, first, let's talk about what palliative care is. It's specialized medical care for people living with a serious illness, focuses on providing relief of symptoms and distresses. The goal is to improve quality of life for the patient and all that love or care for that patient. Palliative care is provided by a specialty trained team, usually consists of doctors and nurses, but can have other specialists too, social work, physical therapy. Depends a little bit about where you're at and what the team's made up of, but usually the core of the team is physicians, nurses, and social workers and chaplains. And they work together with all your other providers or doctors to give an extra layer of support. So while the oncologist might be really focused on getting you curative treatment or life prolonging treatment for your cancer, your palliative care team is really focusing on what else do you need in addition to that to make your life as good as possible, hence the extra layer of support. And we can do this at any age or any stage. You don't have to be a certain level of sick or a certain age level to get palliative care. You can get it anytime, and you can get it along with all your other treatments. So the ultimate goal is to provide those that are living with lung cancer or other serious illness with the best of what medicine has to offer in terms of cure and disease-targeted treatment. Keep us alive, right? Keep us alive. That's what we want. But we also want to provide the best of what palliative care has to offer in terms of managing symptoms and improving quality of life. So we should be able to have both. We have a system that has enough expertise to give both, so that should be our goal. One of the challenges we face is that there's not a lot of public awareness about what palliative care is. We actually have done like research on this and know from surveying almost 1,000 adults over the age of 18, we asked them what, if anything, they knew about palliative care. And as you can see here, there's only about, less than 20% or about 20% that really felt that they were knowledgeable, somewhat knowledgeable, or very knowledgeable about palliative care. That meant the majority really had no knowledge at all, or didn't even know what we were talking about. So, not everybody knows to ask for it because not everybody even knows what it is. In this group of survey respondents, once they answered the initial question about palliative care, they were informed about palliative care. Basically, they were given a definition that it's an extra layer of support, that it can be done alongside curative treatments. All the things we talked about earlier was with respect to palliative care, that information was given to these survey respondents. And after they heard the definitions and had the descriptions of palliative care, 92% said they would be likely to consider palliative care for themselves or families. That same percentage, 92%, believed patients should have access to palliative care nationwide. And 95% said that patient and family education regarding palliative care as part of the treatment plan is important. That's pretty powerful stuff. So overwhelmingly, people felt positive about palliative care. So we asked, we looked into the oncology field. So when patients have lung cancer, oncology is a big centerpiece part of your care. And so ASCO, which is a national organization for oncologists that help them define what their best practices are for treatment of cancer, They actually advise their oncologist that patients with advanced cancer, whether inpatient or outpatient, should receive dedicated palliative care services early in the disease course, concurrent with other active treatment. And that referring patients to interdisciplinary palliative care, and interdisciplinary just means a team with different members, that referring patients to these teams is optimal, and that services may complement existing programs. And providers may refer caregivers of patients with early or advanced cancer to palliative care services as well. So what is this saying? It's saying that the best practices for oncologists who are treating cancer is to get palliative care involved to help support patients and families beyond just the cancer treatment. So the impact of palliative care is that it relieves pain and symptoms. Patients may live longer. There was a real famous study done in the New England Journal of Medicine that showed that patients with lung cancer and traditional therapy didn't live as long as patients that got traditional therapy and palliative care at the same time. So patients may live longer with palliative care in addition to their disease-targeted treatment. It offers better family support. It can reduce hospitalizations, emergency room department visits, and reduces unnecessary tests and procedures as well. You know, we really try to get beyond the disease and find out who the person is and what's important to them so that we can improve their quality of life. And this is a really, really powerful ad campaign from the American Cancer Society. It's a few years old now, but I love these depictions, and because they put the human aspect back into it and remind us. And I look at these, you know, regularly doing these talks, and every time the screens pop up, it reminds me of, you know, the person being just as important, if not more important, than the disease I was trained my whole life to treat. And with that reminder, your clinicians can really focus on, you know, helping you to become or get to a place where your quality of life is as good as it possibly can be. So palliative care plus oncology care together is the best and highest quality of care. You want that chemo and radiation, surgery, whatever disease targeted treatments there are. Boy, when I think about cancer, I want my oncologist to be thinking about firing every gun on deck. Like I want it. If you have it, I want it. But I also want quality of life. I don't want to be sick the whole time and unable to enjoy, you know, doing the things that are important to me. So this is where palliative care comes in. We offer that psychological and social support, symptom treatment. You know, if somebody has impairments, we can help them with, you know, rehabilitation. There's other therapies that we use, cognitive behavioral therapy, relaxation techniques. It's a collaboration, and it can happen at any point in your diagnosis. So that's really the bottom line of what we're trying to accomplish here. And this doesn't work without skilled communication as well. We need to be talking to each other. I know when my dad was real sick, he used to say to me, Andy, like, I don't need any more doctors. I just need two that will talk to each other. And that's really where, you know, this collaboration between palliative care and oncology works so well, is when that communication is two-way. When I'm talking to the oncologist about what's happening with you, they're talking to me about what's happening with you, and together we're coming up with the best plan for you. That's really the gold standard of what we're aiming for here. We want to extend survival with the highest quality of life. I mean, it's that simple. So usually when I talk in front of a group, this is where we'd open it up for Q&A. And so because we don't have that luxury on a recorded webinar, we compiled some of the most frequently asked questions, and we'll just work through those. And hopefully these answer a lot of the things that may be on your mind if they weren't answered in the formal presentation. So a very common question we get asked is, when does someone need palliative care? Well, it's based on need, so not prognosis. So get prognosis out of your mind. You don't have to be a certain level of sick to get this. You may need it if you're suffering, whether that's suffering from pain, suffering from emotional problems like depression or anxiety, other symptoms, nausea, fatigue, or stresses or side effects of treatment. So, you know, if you're not doing as well as you think you should be doing, you know, this is when you should be thinking about palliative care. You can have it at any age and at any stage. You don't have to be a certain age or a certain level of sick to get it. If you don't feel like you're doing well, reach out and give it a try. Can you have it along with your other treatments? Yes, is the answer. Absolutely. It's when it works best. The impact of palliative care is that it relieves symptoms. You may live longer, better support for your family, reduces unnecessary tests, hospitalizations, and emergency room visits. It's a similar slide to what we had before. Should a patient bring it up to their doctor or wait till the doctor mentions it? The short answer is it's either. But I always kind of counsel patients, don't wait until the doctor brings it up, because your doctors, especially oncologists, other busy docs like that, they're caring for you, they're thinking about you, but they have 100 other things on their mind. They're thinking about the chemotherapy doses, how you're tolerating side effects. They're not necessarily thinking about what the experience of you living with it may be. Because as if I did mention before, I'll mention it again here, or I'll mention it here. We don't get trained to ask how the patient's doing. So, it's not on our mind to bring it up. So most people end up asking their doctors for a referral to palliative care. And because we're specialists, we need a referral usually from the primary doctor to get that done. So when and how do you ask for a referral to palliative care? Well, if you're suffering, whether it would be with pain, other symptoms, or stresses, we encourage you to ask your doctor for a palliative care referral. Explain to the doctor you'd like a referral to palliative care for an extra layer of support. It's not going to impact their treatment other than it may help you stay on treatment, because we deal with some of those side effects. And if you visit getpalliativecare.org, there's a lot of information there. There's actually downloadable tip sheets on how to talk to your doctor and a lot of other resources that I think we're going to get to in the next screen or two here. So the resources I recommend for patients and families who are living with lung cancer or other serious illnesses is get familiar with getpalliativecare.org. Clearest, most comprehensive website on palliative care. It'll be just a treasured resource for you as you continue on your journey through this. It provides definitions. It has a quiz to assess whether palliative care is right for you. It talks about how you get palliative care. There's tip sheets on how to talk to your doctor about it. There are real stories through free podcasts, recorded videos, blog posts. There's a provider directory where you can search by city, state, or zip code for palliative care in your area. And there's a great download for patients and families. It's a handout that will help you navigate through your lung cancer. So I'd encourage everybody to get familiar with getpalliativecare.org. Most of your questions will be answered there. And again, I think the expectations for patients and families should be that you get the best of what you can from your oncologists and other providers in terms of targeting your illness to get you cured or to get you to live as long as possible. But we don't have to do that while we suffer. We can do that with a quality of life that is acceptable to us. And that's where palliative care comes in. So I hope this has been informative to everyone. I hope you get familiar with getpalliativecare.org, and please, visit some of the other recorded presentations on this website for more information. And thanks for your time, and good luck.